afternoon, everyone. I hope you're well. We'll just give it another minute or two and then we'll start our presentation. Alrighty, folks. Well, we might get a wriggle on. So welcome everyone to our tender information session. This is the 2023-2024 Early Intervention Initiatives for Older Australians for Bass Coast and Baw Baw Shire. Before we begin, I'd like to acknowledge the traditional owners of the land that we're meeting on today and pay our respects to their elders past and present, and to any Aboriginal and Torres Strait Islander people who may be joining us today. I'd also like to acknowledge people with a lived experience, their families and their carers, and recognise, respect and affirm the central role that lived experience serves in our work here at Gippsland PHN. So welcome everyone. My name is Heidi Glossop-Clark. I'm the Aged Care Coordinator with Gippsland Primary Health Network. So this session is being recorded and a link will be made available as an addendum via Tenderlink along with the PowerPoint presentation. If you'd like to opt out of being recorded, please note that you can switch off your camera and we'll take questions at the end of the presentation. Please keep your microphone on mute during the presentation and use the raised hand function if you have any questions. Alternatively, you can place your question in the chat box. We may decide to take questions during the session on notice, and if this is the case, we'll then post the response via the Tender online forum in Tenderlink after the session. So who is Gippsland PHN? Gippsland Primary Health Network is a non-for-profit organisation funded by the Commonwealth Department of Health to coordinate primary health care across Gippsland in Victoria. The Gippsland region covers the 6 local government areas of Bass Coast, South Gippsland, Latrobe, Baw Baw, Wellington and East Gippsland. We have 3 offices located throughout the region at Wonthaggi, Traralgon and Bairnsdale. Commission services via tender. Why is Gippsland PHN commissioning services via a tender process? Commonwealth's PHN program guidelines determine how PHNs should commission services. Tendering is a standard expectation of the Commonwealth and of the public wherever public funds are being spent. Competitive procurements ensure that we obtain the best value for money, meet local needs and address service gaps. Consumers benefit by having access to the best providers for their healthcare needs. Older Program Overview. So what is the Older Australians Initiative? Gippsland PHN has been funded to commission early intervention initiatives to support our senior members of our community to live in their own homes for longer. It is anticipated this intervention will reduce the prevalence of chronic disease and reduce the impacts on the health sector. From research recently undertaken, chronic diseases such as cardiovascular, musculoskeletal, respiratory, and diabetes have a higher prevalence in the Gippsland community. Interventions that address these areas will be highly desirable. The indicative budget. So the indicative budget for the total of this procurement included all related expenditure is up to a total of $333,400. So $333,400 excluding GST across both the catchment areas of Bass Coast and Baw Baw Shire. Service delivery is expected to commence from the 1st of May 2023 and conclude on the 30th of June 2024.
Heidi,
yes,
Katie here. We're not seeing the slides move forward for some reason.
Oh, aren't you really?
No, we've just got the front page slide at the moment.
Have you really? That is really bizarre. Katie, would you like to share? And that is very weird. How about I stop sharing?
Sounds great.
I'm terribly sorry, folks. I'm having a wonderful time zooming through all my slides.
Let's see if I can get it working.
Beautiful. And we're on to the required services page now, Katie.
Can you see
Beautiful.
that?
That is perfect. I can. I'm hoping others can too. And apologies, folks. It's obviously a technical glitch down my end. Things are zooming along nicely. All right, if we're happy to proceed, let's keep going. So the required services. 1 second. I'm terribly sorry. Oh, the mobile phone going in the background. It is expected that tenderers will address elements within the tender application to support positive ageing initiatives within the community. These models will be community-based and are required to reduce the impacts of chronic disease for those who participate in the program. Providers are encouraged to consider innovative models to address the criteria. Gippsland PHN are looking for one or more providers to maximise service coverage across Gippsland. You may offer one or more services across one or more catchment areas, and if this is the case, please ensure this is clearly defined in your proposal and that budgets are aligned accordingly. It is suggested that tenderers address each component of the services independently with corresponding budgets. So please be clear with your description of your model, which will assist the evaluation panel in ensuring there is maximum coverage across the Gippsland region. If additional budget allocation becomes available, we may be able to consider some more options for top-up services. Thanks, Katie. Next slide, thank you. Beautiful, tender timelines. The request for tender will close at 5 p.m. on Friday, the 24th of February 2023. Tenderers will be evaluated in March. Recommendation for awarding of contract will be presented at the Gippsland PHN board and the meeting scheduled for April, and pre-contract negotiations will occur in April. Services will commence from the 1st of May. Next slide, thanks, Katie. Beautiful. So early intervention initiatives. What will the tender evaluation panel be looking for? Tender submissions should address the early intervention initiatives which are listed on page 3 of the tender specification documents. This refers to Gippsland Primary Health Network receiving funding to support senior Australians to live at home for as long as possible through the use of early intervention activities and models of care for chronic disease management that will promote healthy ageing and reduce the pressure on local health services. Other options that can be considered include services that support general practitioners and other primary and allied health professionals through training, tools and resources that contribute to improved health and care outcomes for older people. These are also within the scope of this procurement. Early intervention models may address some or all of the following, but are not limited to social isolation, loneliness and social connectedness initiatives, falls prevention initiatives and strengths-based programs, intergenerational programs, health promotion and early prevention programs, and tools that support healthy ageing in the community. Next slide, thank you. Procurement objectives. What will the tender evaluation panel be looking for? Tender submission should meet the procurement objectives listed on page 3 of the tender specification. The aim of this procurement is to commission skilled and experienced providers to deliver services that support community-based early intervention activities for older Australians in Gippsland, whilst progressing the quadruple aim of primary health care in Gippsland. This includes improving the health of the population, the patient experience of care, the healthcare cost efficiency. Proposed models should be evidence-based, new and innovative, and models that are measurably sustainable and improve the quality of life. Family and community inclusive, culturally safe and respectful and sustainable models will be favourably considered. Thanks, Katie. So planning your tender response. So what will the tender evaluation panel be looking for? Tender submissions should meet the evaluation criteria listed in the tender specifications. These are addressing needs, capable organisations, quality care, improving access, and coordinated care. When addressing the evaluation criteria, pay attention to the considerations that are listed within the criteria, and please make sure you answer all questions in full. Some considerations for when you are preparing your tender. What will your service delivery proposal look like? Your proposal needs to clearly meet the procurement objectives. The tender evaluation panel needs to clearly see and understand the vision and detailed model of service that you are proposing. How do you intend to deliver the services? Will you partner with other organisations? And if so, what will be the roles and responsibilities of each partner? Where will the service operate from? Will in-reach or outreach services be offered? And how will clients or patients enter and exit the service and re-enter if required? Proposed team structure. Design the proposed team with enough EFT to deliver the services with suitably qualified staff and supervision arrangements in place if required. What levels of qualification will each team member require? Consider your administration staff to support the service and clearly outline your proposed team model. Reporting requirements. There will be a completion of an activity work plan and a completion of and submission of a budget forecast and profit and loss acquittals. And how will you structure your budget proposal? Value for money is a key objective of all procurements. Be clear on what is proposed to be spent and where. Missing information leads to increased risk and reduced technical scores in the evaluation proposal. Standard operation costs should not be included, only include items that directly relate to service delivery. Carefully consider the percentage split between corporate and administrative costs versus service delivery costs. Where possible, reduce expenditure on corporate and operational costs and increase the expenditure on service delivery. Clearly define EFT required for the model of service and consider the appropriate qualification levels when costing against staff. How will you address risk of overspend? How will you address risk of underspend? Present add-ons and options for additional consideration. Cross-check your budget items against the service delivery proposal. Is the FTE correct in both? And the delivery timelines? Are all the events, activities included in the budget? Consider travel costs, stakeholder engagement, advertising, or anything else that's included. 3 aspects to consider in terms of stakeholder engagement. Identifying all potential stakeholders, including Gippsland Primary Health Network, describing when and how you will be engaging with each stakeholder, and what are the objectives and outcomes of stakeholder engagement. Service delivery plan. The evaluation panel wants to understand how quickly a tenderer can hit the ground running if awarded the contract. Any background preparation, research, negotiations with subcontractors, etc., should be done prior to preparing the tender and therefore not included in the implementation phase of the timeline. Consider the barriers to commencing service delivery ASAP and clearly address these in your plan. Risk matrix. The panel will look for risk across all components of the proposal. Identify all risks related to the proposal and provide appropriate realistic mitigation strategies to address them. Propose clinical governance framework and processes. Provide confidence that the clinical governance or governance arrangements are in place and that the service is patient-centred and culturally safe. Service promotion. How will you promote the service to community and other stakeholders? Thanks, Katie. Next slide. So further support for writing your tender response. Gippsland Primary Health Network has produced a tender box, which has supportive information to assist with developing tenders. The tender box is available on the Gippsland Primary Health Network website. And the next slide. Tenderlink. You must be registered with Tenderlink to download the request for tender documentation and upload your submission. You can register with Tenderlink at no cost via the Gippsland Primary Health Network website portal. If your organisation's key Tenderlink contact has left the organisation, you'll need to contact Tenderlink's customer service team to reset your login. And next slide, thank you. So now we're going to open up the floor to any questions from the audience. So please use your raise hand function, and if you have any questions, feel free to pop them in the chat box. Any questions? And Katie, I can't quite see the chat box. I'm wondering if there's any questions in the chat box either.
Look, I'm actually having trouble seeing the chat box as well. So maybe if people can just unmute and pose your question. Thank you. Thanks, Catherine.
Hi there. Thanks, Heidi. Just because we didn't have the slides up, can you just revisit the budget, please?
The budget, for sure, yes.
Just the total budget and over which areas, please. Thank you.
That's right. 333,400 is the total. And it's over Baw Baw Shire and Bass Coast. So that's the delivery in 2 areas, that total budget. Beautiful. Any other questions before we proceed to our last slide? No, beautiful. Why don't we do that, Katie? So additional information. So thank you so much, everybody, for coming along and for your attendance today. And apologies about the kerfuffle with the slides. They were graciously moving down my end, obviously not so much your end. A link to the session recording will be made available as an addendum to the request for tender via Tenderlink. Additional questions on further information. So questions regarding the procurement should be submitted via the online forum in Tenderlink. Technical questions regarding access to Tenderlink or how to upload your submissions can also be directed to Tenderlink as well. And some information is available on the procurement page of the Gippsland Primary Health Network webpage. And for other general inquiries, these can be directed to procurement@gphn.org.au. Best of luck with your tenders, everybody, and look forward to reading your innovative proposals. Bye for now.